that bad, and a lot have been infected, a lot have been vaccinated, they have followed all the rules. So right now, in the middle of the summer, with great weather outside, to wear a mask would be something difficult for them to accept. So this is why we recommend it more specifically for the persons that are at risk.
And as a follow-up, how worried are you about the ability of the healthcare system to handle a rise in cases at a time that they're saying that they're very understaffed and overcrowded?
Yeah, it is something that we are really sensitive of. We are concerned about that with our colleagues at the ministry level, and also all the clinical teams and the managerial teams in the institution, in hospitals and other institutions too. So it is something that is followed very carefully, and we are trying to look at all the possibilities of adjusting the services to make sure that the best will be done for the citizens, and also taking care of the capacity and the needs of healthcare workers to benefit from a summertime and some vacation for all that they've done so far. We have to respect it. The minister was very clear about that, and I think that all that is feasible. It's a tough ride. It might be a tough ride, but it's feasible. We do not think that this hiring of case will get very, very high in the near future. We expect it to be to continue to rise again, but to be followed in the next few weeks by a lowering, which would be great.
Thank you. Dan Spector. Dan Spector.
Hello. Yeah, sorry about that. Just wondering if you could elaborate a bit on this, the decision to sort of emphasize what the immunocompromised and people who are vulnerable should do, whereas I guess pretty much leaving everybody else alone. Like, why this?
Thank you. This is quite simple in a way. It's becoming more of a personal responsibility regarding your risk regarding COVID. We are at a different stage right now, given the vaccination that is highly efficient again, given the treatments that we have on hand, that it's actually more efficient to have measures that are taken on a personal basis regarding on your risk factors. I mean, we could impose a mask for millions of people, while in fact those that actually have the greatest benefit from it will be really in targeted populations. So this is the reason why at this point, regarding the situation, regarding the experience in other countries of the world, that we are at this point focusing the message on those that have actually a higher risk of complication. And again, it's the same tools: vaccination, masking, and treatment if that is eligible.
And how are you guys, what are you guys thinking about the new Moderna vaccine that's supposed to come out that is supposedly efficient against these new variants? Are you guys excited? What are you thinking about that?
Well, Moderna and Pfizer actually will be coming up both with a formulation of their vaccine. The studies that have been performed by the companies for these vaccines, the new one, actually are based on titers, blood titers of the antibodies elicited by the vaccination itself. So we don't have at this point clinical data regarding how efficient it is regarding the new variants. Definitely, we hope that these new vaccines will be more efficient to prevent infection and also complication for the newer variants. But at this point, we don't have this data available. But definitely, this is something we are on the lookout, and let's hope for the best. If it does diminish infection, that will be a great news.
Thank you. Steve Rukovina.
Yes, Dr. Boileau, you touched on this in French, but in what circumstances right now are you personally wearing a mask?
I mean, you're talking about me? personally?
Well, you said if you were going to go to an outdoor festival
Okay.
for yourself, you'd put on a mask. So I'm just wondering generally
So,
for your.
so I will have to wear one if I go to a festival. Okay. So no, I'm just teasing you. I think that it's not my personal situation. It's more related to what Dr. Lontain just said. It becomes to be a personal matter how you will deal with the risk of getting infected by COVID. So I think that there are some situations, and in particular, if you wish to be in a group, even if it's outside and there's a lot of contact and you're in the middle of a group and where people are singing or at festival or things like that, I think I would argue for myself that it could be better to wear a mask. But in other situations, it will be kind of related to the risk. I mean, it's not something that should be taken for every situation. It has to be managed on a personal perspective of the management of the risk of being infected. And I think that some people do not care about that. Maybe they would have reasons for that because they are well vaccinated and young and in good shape. But for others that have been sick so far and suffer from chronic diseases, should it be asthma, diabetes, or other things, I think the question will be different for them. So it depends on for each.
And what do you envision for the fall beyond this more recent increase? What do you see happening in the fall when people return to school and return to work and are indoors more?
Yeah, well, the expert that we consult a lot on those situations, and especially Dr. Lontain and others, are expecting that with the experience we had so far with those variants, that there might be an increase again at the autumn or late summer because of the situation of the workers that will be now more in contact, the families at school. So, and with the freezing outside that will come back again, this is something we're sure there will be an increased risk of contagiosity. So we expect it to be much stronger than it is right now, but we'll see. And with the help of a good vaccination program, probably that we will be able to face it and to be comfortable with all of that.
Merci. Il nous reste tout juste une petite minute. J'ai Vincent Brousseau-Pouliot qui voulait poser une dernière question. Merci d'ouvrir votre micro.
Oui, je vous remercie. En fait, c'est juste une question. De façon générale, on comprend qu'il n'y a pas d'obligation, mais c'est quoi vos recommandations pour les Québécois qui n'ont pas nécessairement de situation particulière de santé, qui ne sont pas dans un facteur à risque? Ils ont peut-être disons qu'ils ont 2 doses. Là. Comment ils doivent vivre leur été, dans le fond? Est-ce que vous leur dites, sans les obliger, mais est-ce que vous leur dites, c'est quoi les 2-3 choses, au fond, qu'on devrait tous faire pour diminuer les risques? Qu'est-ce que vous pensez qui est nécessaire? C'est pas des obligations, là, mais est-ce qu'ils doivent absolument les prendre la 3e dose, sinon pas après 3 mois? Bref, je ne veux pas vous donner des suggestions, là, mais qu'est-ce qui est important là, en 2-3 points pour les gens cet été, à votre avis, à faire?
Moi, je pense que c'est pas juste 2-3 points, là, on va se résumer comme ça. Là. Premièrement, pour ceux là, qui n'ont jamais été vaccinés et qui n'ont pas fait la COVID, c'est le temps d'aller chercher une bonne vaccination parce que ça va vous aider beaucoup, mais je ne suis pas sûr qu'ils vont suivre mon idée. La deuxième, c'est pour le monde en général, là, actuellement, durant l'été, il y a moins de contacts qu'on a à l'intérieur. Les enfants ne vont pas à l'école, etc. Le risque, il est diminué d'une façon générale. Mais là, en ce moment, c'est pas ça qu'on voit. C'est qu'il y a une augmentation de la circulation du virus et ça explique la remontée des cas, bien sûr, puis des hospices qu'on voit. Fait qu'il y a un risque qui est plus élevé que ce qui était au tout début du mois de juin. Là. Donc, quand on sortait de la 6e vague, ça allait bien, puis c'est pour ça que les mesures ont été élevées, puis le paysage était très correct. Mais on le voit depuis 3-4 semaines, ça monte, puis ça a monté encore là, dans les dernières journées et la dernière semaine. Puis c'est pas appelé à descendre tout de suite. Donc, pour les gens en général, il faut qu'ils soient conscients qu'il y a un risque d'avoir une COVID. S'ils ne veulent pas l'avoir, puis qu'ils veulent bien s'en sortir, qu'ils portent un masque et qui aillent bénéficier de la dose de rappel, que ce soit la 3e s'ils ne l'ont pas eu, ou même la 4e. Mais ceux à qui on le recommande vraiment, c'est les personnes qui sont plus à risque de développer une maladie plus grave. Alors, les personnes immunosupprimées, ou immunodéprimées, les personnes qui ont des maladies chroniques, les personnes plus âgées de 60 ans, mais plus âgées encore, 70, 80 ans, là, on devrait commencer à être pas mal prudent parce que ça circule encore beaucoup. Alors, c'est pas de dire, écoutez, là, on est dans une situation hautement à risque, c'est de dire, voici ce qui se passe, il y a une croissance, elle est là, on a plus de cas, soyez prudents, c'est là. Si vous voulez vous aider, portez un masque. Si vous voulez aider ceux qui sont plus à risque autour de vous, vos grands-parents, vos mononcles, etc., que vous les voyez, les personnes plus âgées ou plus malades que vous connaissez, portez un masque pour les aider et elles, portez-les aussi. Et puis avec ça, on va bien s'en sortir, puis ça va probablement diminuer. C'est ça qui est le but visé. Puis à l'automne, on reviendra, puis on se reparlera pour voir où est-ce qu'on est rendu, puis où est-ce qu'on s'en va. C'est vrai correct, Dr. Lontin?
C'est excellent.
Ben voilà. Alors,
C'est ce qui met fin à cette conférence de presse. On vous remercie.
merci beaucoup. Merci.